Okay, my name is David Sanders. I'm the Chief Probation Officer for the Superior Court in Pima County and a member of this committee, and I will call the meeting to order today, August 1st, 2023 at 1:31 p.m. Should we move on to the minutes from our last meeting?
Yes, sir.
Do I have a motion to accept the minutes?
Chief, sorry, I jumped ahead. Could you have a call roll, please?
Oh, I'm sorry. Yes, let's proceed with roll call.
Dave Byers.
Shanda Breed, proxy for Dave Byers.
Kara Riley. Paul Penzone. Jeffrey Glover. Laura Conover.
Barrett Green for Laura Conover.
Rachel Mitchell.
Good afternoon, Rebecca Baker for Rachel Mitchell.
Chris Mace.
Kirsten Flores for Chris Mays.
Jean Bishop. Dave Sanders.
Present.
Dan Levy. Okay. Adam Adenloff.
Present.
Rosemary Penn Lynch. Margie Balfour.
Here.
We have a quorum, sir.
Thank you. Are we prepared to move into the presentation?
Chief, if you could we approve the minutes of the June 7th meeting since we have a quorum?
Thank you. Do I have a motion to accept the minutes as drafted?
Barrett Green so moves on behalf of Laura Conover.
Thank you, Barrett. We have a motion and a second. Is there any discussion on the minutes? Hearing none, all in favor signify by saying aye.
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 Right.
The chair also votes aye, and is anybody opposed? Hearing none, the motion passes unanimously. Thank you.
Chief, before we get into the presentations, if you would allow, may I give a quick program update?
Absolutely.
Thank you, sir. Members, appreciate your attendance for the advisory board. Just wanted to give you an update on where we're at. At the last meeting on June 7th, you approved a program plan. It was a requirement of the grant. And you approved an overall budget, also a requirement of the grant that the advisory board do that. We sent those documents into BJA, and they just recently here approved both the program plan and the budget. What that means is we can move forward with the grant process. Also, as part of that program plan, we have a competitive grant option, which is primarily the way that we fund grant projects through ACJC. But we also have a non-competitive approach that if there is an instance where a project comes forward that really does not make sense to apply in a competitive environment because it's not competitive, that we have the ability to evaluate the project, move it forward to the advisory board, and you as a body would approve the project or not approve the project. The thinking behind that really is driven by what we're doing with AOC. As part of the program plan, you also approved a certain amount that has to go either to AOC or be allocated out to individual jurisdictions. It's called the less than 10,000 group. And you decided at the June 7th meeting to allocate that money out to AOC as a statewide court. it's possible the AOC can come up with a project that money can only be spent now by AOC. They can come up with a project that it wouldn't make sense for it to be a competitive process. So we have that option available as part of our program plan. We're going to move forward with the competitive process. We think that we can have a solicitation roll out in September, maybe mid to late September. Go through our competitive grant process, score those applications, and bring a recommendation to you as the advisory board by in the February timeframe. Whatever you approve will have to go to the full commission at the March meeting for them to approve so that we can contract with those subrecipients that you approve. And so we think that's a better, more adjusted timeline. We had some visions on doing this a little bit sooner, but we have to interact at points with BJA by sending them work product and have them approve that work product, and that takes time. And so you approved that project plan on June 7th. We sent it in a couple days later. It just got approved. And that's just a workload issue with BJA. They're doing this with 50 states and then some other territories. And so we have to have some patience for that process to play out. But we think by the March timeframe, we could have all projects approved by the advisory board and the commission and have grant agreements sent out and start those projects as soon as folks can. Let me step back. After the commission approves them, we have to send them back to BJA for them to approve them. So there's this sort of redundant bureaucracy that we have to deal with this grant. That's the way it's set up. And so that's what we'll do. We also have a web page dedicated to SCIP that's on the ACJC website. We're going through the process of updating that page and including a number of different types of resources for not only you as advisory board members, but also the public so that they could see what's happening with this grant. And if they want to participate, they'll know where to go. If they want to submit a project, keep in mind we will have 3 more applications that we need to send into the federal government with 3 more additional grants of about $3 million that we'll get out of this Safer Communities effort. So we're going to be here a while. And so we want to provide as much information as we can on that webpage. We'll include things like funded projects, any evaluations that we end up doing through our Statistical Analysis Center, any research or resources that we find that we think would be helpful to either the advisory board or the public, that any organizations that may participate. We're going to include as much of that as we can. Last thing, Mr. Chairman, members, I wanted to tell you is just a point of clarification. We saw some news reports in the media about ERPOs, about emergency risk protection orders, and this particular grant program. So we just wanted to clarify, in our project plan that you approved, that BJA now approved, we do not have any projects related to ERPOs that we would support through this grant program. The reason for that is the ERPO law really needed to exist in order for you to spend this grant money on it. We cannot use ERPO dollars to write a law related to ERPOs or red flag laws, or lobby for red flag laws or ERPOs. And so I just wanted to clarify that we did include the possibility of ERPOs in our application to the federal government. That's just it's more of a technical, strategic approach to applying for a grant. You include as many things as the grant allows for, knowing that you're going to refine it down once you get the grant and are going to actually develop a grant program. And so when we develop this grant program, ERPOs don't exist in Arizona, and we won't be using any of this money unless in the future they do exist and the grant is still around. That's a different story, and we'd have to go through a process to get those approved as part of the project plan because it would be a change. And so I just wanted to make that, make you aware of that. And that concludes my update, Mr. Chairman, members, and we can move into the presentations.
Thank you for that update. Let's go ahead and move in. I'll ask some questions.
Chief Sanders, I just have one question, if I may.
Go ahead, please. Sure.
This is Shanda Breed speaking. You stated that the competitive grant, that timeline, it may not include the non-competitive timeline. Is that correct?
It would not.
Could you go over the non-competitive timeline?
I don't know because I don't know what projects are out there that would be submitted. It's a good question to ask because it leads me to emphasize the non-competitive option is not a way around the competitive. There are certain strict standards that we've laid out in the project plan. So if anybody's interested in exploring that option, I suggest that you look at those. It is meant to be more efficient in the way that we're granting out dollars and not requiring an organization or a group to apply competitively and have us go through the process of scoring when it's meaningless, really. That will likely develop a communication to organizations and agencies on that opportunity. It will happen, I think, sometime shortly after we roll out the competitive, because I think we want to get that process going. Dealing with the direct grant option is a little bit easier on staff because all we'll do is compile the information and summarize the projects and make sure that it meets the criteria. But after it meets all those, we're bringing it to the advisory board, and the advisory board is the one that will decide. And so it's a little bit less workload on us. So we want to get the tougher workload out there first. But I think it's probably a few weeks after we roll out the competitive is when we'll start reaching out. We know to reach out to AOC specifically because they're the ones that make the most sense of it being a direct, but I don't know who else is out there.
Sure. Thank you.
Mr. Chairman, were there any other questions?
I don't believe so. Why don't you
Okay.
move on that?
All right, Mr. Chairman, if there's no questions, we can move into the presentation part.
Thank you.
Mr. Chairman, members, we have 4 presentations that we're going to offer you today. First up is going to be Matt Bolesky. He's our research and data manager at ACJC. He oversees not only data and the implementation of our data effort at ACJC, but he also oversees the research conducted by our Statistical Analysis Center. And we asked him to give a presentation to you, just a brief one on sort of this high level perspective of gun violence in the state, particularly as it compares nationally, but also touch on the problem of suicide as well. So Matt's going to give that to you. Then we're going to turn to Lieutenant James Hester from Phoenix PD. He's going to give you a presentation on gun crimes and trends in Maricopa County. Then Sergeant Ben Soltero, who's going to talk about gun violence and gun-related violence statistics in Pima County. And then finally, we'll end with Dr. Margie Balfour, who is also a member of this advisory board, who will give us a presentation on mental illness and firearm deaths and how to access Arizona crisis services. Crisis response is an important part of this grant, and so we want to make sure that we're addressing that need. So without further ado, Mr. Chairman, Matt Bolesky.
Mr. Chairman, members, hopefully you can hear me all right. I'm going to bring up the presentation here online really quickly. Okay, and hopefully all you can see that presentation on the screen. I'd like to talk a little bit about the National Violent Death Reporting System as it relates to Arizona and nationwide. All 50 states participate in this effort currently across the entire country, as well as two territories are included in that reporting. The NVDRS is a state-based reporting system overseen by the CDC. We have 600 data elements, 600 plus data elements that are captured in this system, looking specifically at violent deaths that are reported across the state of Arizona and nationwide. This includes incidents that are reported related to firearm violence for homicide, for suicide, legal intervention, unintentional deaths, and then there's also a catch-all category, an undetermined intent category. We won't be talking about that one here today, but I'm going to try to touch on the four and then concentrate mostly on homicide and suicide, looking specifically at Arizona because we don't necessarily meet the threshold for a lot of the data to be reported for the legal intervention and unintentional when we're breaking it down by the specific demographics. So just really wanted to provide that detail of those four here today. And then just to mention that the ASU Center for Violence Prevention and Community Safety coordinates this effort across the state through the AZ VDRS. So we really appreciate the partnership with them in capturing this information. What I'm presenting today is available online, but we are available to reach out to the center to further drill down into any other questions or interest that you may have regarding this data. So we're more than happy to reach out to the center and try to accomplish that task. What we'll be looking at today specifically is all data up to 2020. So we're looking at 5 years, 2016 to 2020. We could reach out and try to obtain some more current data, but this is what's readily available to us at ACJC and others. So I just wanted to start here looking at Arizona versus the national rates involving firearms. These are the age-adjusted rates per 100,000. And so we'll be looking at suicide, homicide, legal intervention, and unintentional firearms here. What we see on the national stage for suicide, just over between 6 to 7 per 100,000. Are being reported for the suicide rate across the country. When we compare that to Arizona, we see that rate much higher here in Arizona, over 10 per 100,000 for most years across that 5-year period. Looking at the homicide rate, we see that rate runs pretty steady around 4 to maybe 4.5 by 2019, and then we see that increase, that tick up in 2020 per 100,000, almost up to 6. For Arizona, we see it very similar. It's a lower, slightly lower rate than the nationwide rate, but we also see that same trend, that tick up in 2019 to 2020, upwards towards 5, possibly approaching 6 in 2020. The legal intervention and unintentional firearms are pretty low, as you see here, but that legal intervention rate is higher in Arizona across all 5 years. Now I'm going to go ahead and break it down in Arizona specifically, looking at certain demographics. For instance, here we're looking at sex, male versus female. We can see on the male side that the suicide age-adjusted rate is between 16 to 18 per 100,000 over the 5-year period. And Chief Sanders, if you wouldn't mind muting, we're getting a little bit of feedback on your phone line. Thank you, sir. We really appreciate it. And then also we're looking at the homicide rate for males. We see that following that similar trend that we saw in the last chart. Right there, almost up to 8 per 100,000 by 2020. Comparing that to the female age-adjusted rates, we see those rates much lower for the female side. Here, looking specifically at suicide rates involving firearms for age-adjusted rates by race and by ethnicity. We see specifically for suicide rates, note that we're only looking at the suicide rates here. For white, we see that roughly between just over 10 and just below 12 across that 5-year period per 100,000. Below that, we have the Black African American trend line there that's under 8 per 100,000 across all 5 years. And then just below that, the American Indian Alaskan Native trend line. We did not have enough data for Asian Pacific Islander to report. I believe their threshold requirement is 10 or greater cases, incidents that occur, and we did not see that across 2018 to 2020. So that is why the data is not available here. When we're looking at ethnicity for suicide rates, that age-adjusted rate for non-Hispanic is upwards of 12 per 100,000 across the 5-year period. We see a much lower for the Hispanic rate that you see below, just over 4, between 4 and 5 per 100,000. Now switching to the homicide rates, we see an adjustment here from, we know that on the suicide discussion about those rates, we were looking at the white non-Hispanic as the highest categories there. Here we see Black African American ranging between about 14, starting in 2016, drops down to just around 10 per 100,000, and then increases there in 2020 up to about 18 per 100,000. Below that, we see the white Caucasian trend line per 100,000, increasing from just around 5 upwards of just shy of 9 per 100,000 by 2020. On the rates by ethnicity, we see a switch here from suicide. For the homicide, we see the Hispanic rate is increasing over this 5-year period to just under 6 per 100,000. And below that, we see the non-Hispanic age-adjusted rate per 100,000. We also include by age, those rates involving firearms by age. I tried to create this gradual change in the color from a really light green up to a pretty dark blue as the age groups get higher, so that you could put in perspective as we see higher or older age groups versus the younger age groups. We can see those trends for both the suicide rates on the left and the homicide rates on the right. And so I think you can notice pretty clearly that those younger age groups for the suicide rates are lower. Those rates are lower, generally speaking. I know there's some exceptions there, but you can see that those darker colors, those older age groups, are higher as we move up that age ladder of age groups. It's directly opposite, generally speaking, on the homicide rates, where we see some of the younger age groups have higher rates than the older age groups. And so I just wanted to highlight that the unique disparities that we see from suicide rates to homicide rates here by age. And then finally, we identified 2 additional categories, special categories that are captured in the NVDRS, current and former military, as well as the homeless. On the suicide rate side, we see those that involve current, former military. These are the percent of the total suicides that occurred both in Arizona as well as nationwide. We see that Arizona rate is higher across all 5 years. And roughly we're at that 25% line. So we're looking at 1 in 4 involve a current or former military member. Looking at the homicides, the total versus that percent of those that are homeless, we see that percentage in Arizona is rather high, approaching 8% there in 2020. And the national trend line is much lower than that, as we see under about 2% in 2020. So with that, Mr. Chairman, that concludes the not so brief presentation of data from the NVDRS, but I think very valuable in this discussion, laying that foundation, setting the stage. And we hope that this brings about additional questions, Any follow-up that you might want us to do for future meetings, we're more than happy to bring additional data to the table. So please do let us know what we can do to provide that to you, and we'll reach out to the center for additional information. Mr. Chairman, I'm available for any questions.
Thank you, Matt. That was very informative. Any questions for Matt?
I just have one comment, if I may. We are really focusing on the 18 to 25-year-old, maybe even 30-year-old group. Just seeing that they have more filings of new felony offenses. They're more risky. The ones that are reoffending more too with recidivism. So we would love for you to highlight those folks in some of these graphs, if you will, for the next time. That would be great. Looking at also their gun usage, and those homicide rates, you showed with your diagram that some of those young folks were using them more. So it'd be great to see 18 to 21 and then kind of the 21 to 25 to 30-year-old even specified, as if we're talking about the really, really young adults or the medium young adults. Thanks.
Mr. Chairman, members, I think that would be a very good value add. We can actually drill down by specific age and create those groups of choice. So yes, absolutely, we'll do that, and we'll try to dig in a little bit deeper to see if we can obtain, as you mentioned earlier, those that are involved in other other criminal activity, either prior to or during, and we'll see if we can identify that and tease that out. Thank you.
Okay, are we ready to move on to presentation number 2?
We are, Mr. Chairman. We'll have Lieutenant Hester from Phoenix PD come up and talk to us about trends in Maricopa County.
Take that back.
Good afternoon, Lieutenant. Proceed whenever you're ready. Thank you.
Good afternoon. Thank you. My name is James Hester. I'm the homicide lieutenant for the Phoenix Police Department, and I wanted to thank the board for providing me an opportunity to present on behalf of the Phoenix Police Department. What we did, the approach that we took in order to present the data for you this afternoon is we reached out to the major details within the Phoenix Police Department that routinely engage with firearms violence and asked them for trends and highlights of what they're experiencing more recently. So that's the bulk of my presentation today. So the first detail that I'm going to speak about is going to be the assault unit. And I know these slides are a little bit difficult to see, so forgive me. I'll ensure if I'm asked again that they are in a more consumable format. But what I wanted to highlight on this particular slide was the percentage of aggravated assaults. If you look across from 2017 through 2023, they appear to be on the rise when it comes to firearm violence involving aggravated assaults with firearms. Can move on. And this slide, it should be noted that the majority of our victims when it comes to firearm violence are either uncooperative or the suspect that is described as either stranger or unknown. Additionally, the times are pretty consistent when it comes to firearm violence. They're usually in the evening hours after dark, and the premises is usually in the roadway or on a sidewalk. So it's not, the majority of our violence isn't occurring within businesses or homes when it comes to violent firearms assaults. And then finally, I alluded to it, the relationship to the suspect is very often unknown or a stranger, but that also correlates with our unwillingness of our victims very often to cooperate with law enforcement when it comes to firearm violence due to risky behaviors or risky lifestyles. The next is, it's a little bit hard to see what this slide is, but this is our crime gun intelligence unit. So this is our detail that's responsible for investigating firearms offenses. And as you can see, when it comes to our seizures for the Phoenix Police Department, our total firearm seizures as well as our crime gun seizures are increasing. They're not monumentally increasing, but they are increasing as a significant percentage. And the difference between total firearms and crime gun seizures, a crime gun is considered a firearm that is used in an unlawful manner. A gun seizure can result as a result of a myriad of issues, including civil forfeiture. But when it's a crime gun seizure, so that 4,935 firearms, those firearms were determined to be used in an unlawful manner. An unlawful manner could be considered possession by a prohibited possessor, someone who's not allowed to possess a firearm. This one's going to be a little hard for me to read. I apologize. I forgot my glasses. But our trends in the firearm violence is the use of ghost guns that are increasing. And a ghost gun is a homemade firearm. So they're sometimes referred to as poly 80s, where people purchase over the internet partially completed firearms, and with a little bit of tooling knowledge, they can create an actual firearm out of it, but it does not have a serial number on there, nor is it required to have a serial number. Machine gun conversion devices. So we see this very often. We consider them Glock switches, where you can attach a device to either a rifle or a handgun, and it turns a firearm from semi-automatic to fully automatic. We're seeing a lot of that with our offenses. Large numbers of rounds fired refers to our crime scenes. So when we respond out to a crime scene that has illegal firearm use, it's the sheer amount of guns and the sheer amount of rounds that are fired within any one incident. They appear to be increasing. It's not uncommon for us to experience hundreds of rounds fired on any given incident. Not to say that the overall injuries as a result of those firearms are necessarily increasing, but the amount of weapons involved and the amount of rounds fired are definitely increasing. Now, those that are familiar with the National Integrated Ballistic Information Network, or NIBIN, understand that when two unique incidents are correlated by ballistic evidence, that's called a NIBIN lead. And what we're seeing is one crime gun used across several NIBIN leads. I'm sorry, one crime gun used across several incidents inside a NIBIN lead. What we're seeing now is that the time frame, the distance between when a firearm is used in between instances appear to be decreasing. So as opposed to a firearm being used once a month in an illegal firearm crime, we're seeing them, say, a week later or a couple days later, and they're getting a lot more common. Juveniles, it was alluded to in the last presentation, are juveniles, due to several factors, including lack of impulse control. We're seeing juveniles utilizing firearms way more often than we have historically, or that we were able to prove historically. Non-traditional gangs is referring to those that grew up in the 80s and understood what gangs were about, where colors, neighborhoods, streets, we're not really seeing that type of gang violence. What we are seeing is groups, usually by common interest or geographically located, that come together to commit crimes with firearm violence. It could be robberies, it could be illegal firearm use or parties, but it's not traditional gangs, but a lot of the same commonalities with gangs are being present in these groups. And social media involvement, I think everybody here understands the use of social media when it comes to crimes and gun violence. I think we can move on. The next one has to do with our night detectives. Our night detectives are responsible, amongst other things, for the majority of our non-criminal deaths. That's our suicides. And they appear to be decreasing from last year to this year, but it also, when it comes to death investigations in general, it's up and down. I mean, this year we're impacted greatly by heat-related deaths, but the suicides, although they appear to be down, it's pretty consistent with suicides across the board. We can just skip this slide because I honestly can't see it. Next is the my detail, the homicide unit. And although if you look at our statistics, our homicides are down in the city of Phoenix, and our homicides with firearms are down in the city of Phoenix. But when it comes to homicides overall, if you could switch the slide for me, you could see that from last year to this year, our homicides have been down, but they're not significantly down, and our killed by private citizens or justifiable homicides are relatively consistent but down. The more important stat, if you could switch to the next slide, has to do with both the firearm as a means of committing the offense, which has been significant. It's been on the rise. It's over 80%, if I can read that appropriately. And then also what's of note in this slide is that males as far as victims and as far as suspects are the primary victims and suspects in homicide investigations. Next slide, please. So our robbery detail, it mirrors other details like our crime gun intelligence unit, where juveniles are pushing a lot of our violence, especially with robberies and other crimes. Street vendors, which those that drive around in our neighborhoods that are local vendors within the neighborhood, they're experiencing a high level of armed robberies. They're easier victims based on the way that they operate and other societal factors. And then we are seeing an increase of robbery victims that are being wounded by gunfire. Here, additionally, I'm sorry, I can't see that. You have to just switch. I apologize. Finally, we're going to talk about domestic violence incidents when it comes to firearm violence. As you can see, it appears from last year to this year that it's maintaining, if you average these out over the year, we're pretty consistent when it comes to firearm violence as it relates to domestic violence. But if you could switch the next slide or the last slide. It also is where it's showing the total reports of domestic violence are down. So total reports of domestic violence are down, but firearm violence is mainly consistent. So as a factor in domestic violence, firearms are maintaining a consistent presence in domestic violence investigations. And then thank you for allowing me to present. I'll take any questions anybody has.
Thank you, Lieutenant. Any questions from the group?
Thank you very much.
Thank you.
Mr. Chairman, members, just note too, we'll have all these presentations posted on our website for your access later if you want to go through them and see them. Next up, Mr. Chairman, we have Sergeant Ben Soltero from Tucson Police Department is going to talk to us about gun violence and related statistics in Pima County.
Hello, Mr. Chairman, members. I just wanted to make sure, can you guys all hear me?
Yes. Thank you, Sergeant, for joining us.
Thank you for having me. Kind of to echo some of the Phoenix explanations over there, we're seeing a lot of the same stuff down here in Tucson. A lot of times Phoenix will see some of the stuff before we will, specific to the machine gun conversion devices and those type of things. But I'll get into that a little bit here in a second. Can everybody see the presentation on the screen?
Yes.
Okay. I'm going to skip through a few of these slides here. Try to get, see any. I'm not sure how do you move to the next slide on here.
We're actually presenting to everybody. So if you want us to move on to the next slide, you can let us know.
Okay, yeah. Go ahead and skip forward. So I'm going to kind of give a little bit of background into the kind of the Southern Arizona gun crime model. Tucson Police Department was about 2 years ago, I took over as the Crime Gun Intelligence Unit Sergeant down here. Since then, we've been trying to implement more of a CJIC, which is a Crime Gun Intelligence Center model of investigating. That's recommended by the Department of Justice and the Bureau of Justice Administration. We've worked a lot with the ACJC on a Project Safe Neighborhoods grant to help make that happen. So to go into that, this is kind of showing a little bit of some of the investigative methods we've implemented over the past 2 years. Our unit specifically has started to look at reactive and proactive investigative techniques. Some of them that are here on the presentation. I'm not going to read through each one for you, but essentially trying to have a more reactive and gun intelligence based model for investigating gun crime. One of the things that we've done is utilizing the area partnerships with other agencies, federal, local, and tribal. And we've got about 15 agencies that are on board now, which has given us a better picture of what our gun crime problem down here looks like and how it's kind of developing and moving around. We've implemented different systems through various grants like the mobile gunshot detection systems, LPR technologies, and cameras, things like that. And we've worked pretty hard to develop a group violence intervention strategy and a focused deterrent strategy. And we seem to be having a lot of luck with those things on the local level, especially in focused areas that we've identified through different crime gun intelligence metrics to try to narrow down and drill down on some of those specific areas. I'll go into the stats here in a bit. Next slide, please. So again, I think we already had this slide. The investigative strategies are more proactive than traditional investigations, where a lot of our units are starting to work toward trying to identify the crime gun drivers in the area, the locations and the people, and then how they're sourcing their crime guns to commit the crimes, and then trying to prevent those things before the violence is committed with the crime guns. That's the general model. We also have partnered with ATF and FBI and TFO'd quite a few of our detectives with those different task force, the Southern Arizona Violent Crime and Gang Task Force with the FBI. And then we've actually got 2 ATF agents that are embedded with our squad that help with some of the federal trafficking investigations and some of the federal prosecution that has a little more teeth than some of the state prosecution in these type of investigations. Next slide. So about April of last year is when we really sat down and tried to redefine what we quantify a gun-related crime as. When we developed that, we were able to create a dashboard that helps us track and identify trends in gun violence over time. And that's, I'm giving you kind of the background so that you can understand where some of these statistics are going to come from. We did develop and stood up our dedicated gun intelligence unit. Prior to that, it was a kind of a co-unit with our gang unit. We've split from that to allow the gun crime intelligence unit to focus more specifically on gun violence and preventative measures. We've also, through various grants and efforts, been able to double the capacity of our National Integrated Ballistics Information Network program. We've doubled our staff, our equipment, and our partnering agencies. I think in the past year, we've added 10 partnering agencies to the NIBIN program, and that's given us a better view of what we're looking at with some of the crime guns in the area. Next slide, please. So this is where we started looking at our definition, which is kind of matches the national best practice of what a gun-related crime is. Some of these subcategories that you're looking at here are showing violent crime that would include everything from like homicides, aggravated assaults, those type of things, down to non-fatal shootings, dischargings. Now, the other gun-related crime category will include prohibited possessors, straw purchase arrests, those type of things. So from year to year, we've only really been able to gather a responsible understanding of gun-related crime between last year and this year. And thus far, we've seen a pretty a good result in a drop in some of those crimes. The one that is the increase here would be the other gun-related crimes. But again, keep in mind that a lot of those are proactive, typically felonious gun-related arrests. So straw purchasing, gun trafficking, stolen guns, those type of things to prevent the violent crimes from occurring. Next slide, please. So this shows kind of a snapshot of recent comparative gun crime statistics. And you can see comparative to last year, we're down in almost every metric for the past week, 30, 60, and 90-day timeframes. And we're well within under our 5-year average for gun-related crime, which last year we were just above the average. And then in 2019 was really our big year. That one we saw our biggest spike in not only gun-related crimes, but particularly gun-related homicides. We doubled our general average that year. So that's when we started reevaluating our gun methods and kind of tracking the gun crime since then. Next slide, please. So some of the trends that we've noticed, particularly this year, are listed here. Gun crime is trending down. It's important to note that we've only got responsible comparative data from last year to this year. prior to that, gun-related crime trends were kind of grouped, and we weren't able to parcel them out. So essentially, we wouldn't be able to define the difference between a prohibited possessor case versus a homicide involving a firearm. So that's kind of the asterisk on that. The PMFs are personally made firearms. Lieutenant from Phoenix PD kind of touched on that prior to my presentation. Those are milled out, or they're basically chunks of hard plastic that's drilled out using jigs to create firearms. You can do them in your own home. They're not illegal to own or have or make. They are illegal when you get into the realm of creating them to sell or distribute. So a lot of times our big cases where we're finding, 40 or 50 of these jigs where they're drilling out a bunch of these personally made firearms, that's on the rise. Lately, we've seen a lot more of the 3D printed gun lowers and things like that. Again, not illegal, but illegal to distribute. The MCDs are considered machine gun conversion devices. Those are essentially things that can be created to quickly change a gun from a semi-automatic to a fully automatic. And in Tucson, we're seeing a lot more of those. We haven't recovered any machine gun conversion devices that have been used in violent crimes this year or last year, but just the volume of increase between last year and this year of our recovered crime guns that have machine gun conversion devices on them is so much that I think within the next year or so, we're going to start seeing those fully automatic conversion devices being used in violent crimes. And then again, the street manufacturing cases, the ones where we have prohibited possessors or prohibited persons that are developing their own firearms and then selling them on the streets. We've had a couple more cases of that, which are pretty rare. But when we see that, we know that there's a problem locally with the rise in sourcing of their gun crimes. The go back, I'm sorry. So the FFL trafficking, we've noticed a lot of the investigations related to the firearms. The federal firearms licensed dealers are essentially your gun stores that are regulated by the ATF. A lot of the multiple sales reports and people that are straw purchasing out of those shops seem to be trafficking the guns to Mexico instead of selling them locally here or providing them to criminals in town. The criminals locally are generally sourcing their guns through car bust, burglaries of residential structures, street trading, and that sort of deal. And then again, I know this has been brought up a few times, but we're seeing it here too, that the majority of gun crime is related to narcotics and gang members, specifically under the age of 22. Generally 15 to 22 is kind of the hot spot we're seeing with that. And what I mean by what it says there, the crime gun with 4 or more NIBIN correlations, essentially that's just saying guns that are being used on multiple occasions are almost always being used by gang members under 22 years of age or for narcotic purposes, which those kind of go tandem. So kind of echoing some of the other sentiment from the other agencies around the state. Next slide, please. And then finally, this is some of the roadblocks we've kind of run into in our efforts to curb gun violence and gun crime in Southern Arizona. We've got some resource issues, particularly investigators that we don't have enough investigators to investigate the volume of gun crime that's being reported. And then if we're trying to do a more proactive approach, that takes a lot more resources to enforce some of these gun laws and it takes a lot more man hours to solve a crime before it happens and prevent violent crime from happening. And we're kind of running into issues there. We have some contentions with some of the systems that we're trying to use. A lot of these systems are new to the public. They're new to elected officials, and they're not really certain how they work, particularly like our license plate reader technology is running into some roadblocks where people don't understand kind of how it works. And it's causing people to feel like there's a big brother aspect to it and that people are kind of being surveilled by the government, which is not the case, but kind of getting over that, developing some policies that are responsible and allowing us to use those systems in an effective and responsible manner has slowed kind of the implementation of those systems. The auctions of the crime guns. So I know there's some state law and federal law that requires agencies to no longer destroy crime guns that are recovered. However, we are seeing a large, they're repeat gun crimes. So once we recover them as a crime gun and they were used in a crime and that case is adjudicated, a lot of times if we can't release those back to an initial victim or something, those guns get sent off for auction at the state level. Once they're auctioned, we're recovering them again. So they're being purchased by, people that are either trafficking them back into the community of criminals or something to that effect. But we're just seeing the same guns coming back in. ATF office down in Tucson has been a huge help with us, but they're having some issues with staffing as well as my shop. And I know that our partners over at the county attorney's office they're just inundated with cases right now, and it's getting hard to kind of make sure that we prosecute all those responsibly. The other thing that we've noticed is as I looked at a lot of our crime guns cases that were prosecuted last year, the majority of the prohibited possessor type cases, those type of things are kind of running into some roadblocks when we go for sentencing. We're noticing that there's a lot of probation plea deals that are given to some of our, not all of them, but most of our repeat crime gun offenders, that gang members under the age of 22, that kind of age range. When we see them get a lot of probation, they get out, they reoffend. And a lot of times we could kind of prevent that by trying to have more stiffer sentencing with the initial crime gun charges. So the prohibited possessor charges, the trafficking charges, the possession of a stolen gun charge. It's not a violent crime, but it's a precursor to the violent crime. And if we're trying to prevent that, it would help to have them not be released again. Because when they do get released, inevitably they're going to get involved in weapons offenses and commit violent crime, and then everybody's going to kind of wonder why they were out. And then juvenile offenders, we're having a hard time. We're having good success prosecuting some of those more high-profile gun cases federally through our TFO programs. But the federal government won't prosecute juveniles the same way the state will. So we'd like to see maybe a more responsible prosecution of juvenile offenders, particularly repeat offenders involving guns on the state level. And that is my presentation. If anybody has any questions, I'd be happy to answer them.
Thank you, Sergeant. That was another informative presentation. Does anybody on the committee have any comments or questions?
Thank you for having me.
Thank you again. Appreciate it.
All right, Mr. Chairman, finally, we have Dr. Margie Balfour from Connections Health Solutions that'll give us a presentation on firearms involving a mental illness and then crisis services.
Welcome, Doctor.
Thanks for
Thank you
having
for
me.
joining us.
And are y'all going to put the PowerPoint up? Is that my understanding? Or do I present it off my computer? Either way.
My computer.
Yeah, I can do that. Let's see. Okay. Oops. Sorry about that. Can everyone see it?
Yes, we can.
Okay. So I'm going to be talking about mental illness and firearm deaths, and then going to switch gears and talk about our crisis system and how to access it. And so first, we already saw a lot of great stats, but I wanted to start with what most Americans think about mental illness and firearm deaths. And this was a survey that was recently done where they asked people, what do you think is the main cause of gun deaths in the U.S.? And most people said murders and mass shootings, which, as we know now, it's that's not the case. 45% of people believe that people with mental illness are, quote, far more dangerous than the general population. 47% believe that mass shootings are more common in the U.S. because of mental illness. And Republicans and Democrats, they agreed on something, that think that better mental health screening is going to be one of the most effective ways to prevent mass shootings. And what the data says is that suicides are the most common, cause of gun deaths, as we've seen. And there are a lot of people in the U.S. who have mental illness. 20% is estimated to have at least one psychiatric diagnosis given in the past year. 6% or 14 million have a serious mental illness or SMI. Most of these people, the vast majority, are never going to commit a violent act in their lifetime, but they are more likely, 3 times more likely, to be victims of violence rather than perpetrators. And when you look at mass shooters, only 25% had a psych diagnosis, and less than 5% were prohibited possessors because of a civil commitment, like a mental health related, thing that makes it so you can't buy guns. So the take home message here is that mental illness, it's too blunt of an instrument for by itself to be used as an indicator for risk of violence and risk of gun violence. So start with suicide, because that's where most of the gun deaths are. It's the 10th leading cause of death in the U.S. It's the leading cause for people aged 25 to 34. And most of the suicide deaths that occur can be attributed to mental illness. And so there's a pretty, strong link there. Firearms are used in about half of those deaths. And part of the reason why is because suicide by firearm, it works. About 90% of the time, that attempt is going to actually end in a death versus like overdosing and other methods like that. And there's lots of risk and protective factors around suicide. I'm not going to go through all of these. This is a slide that we use when we're training our clinical staff around suicide risk assessment. The point is that there's many different risk factors, and access to means, and especially firearms, is one of those risk factors that we can actually do something about when there's a patient in front of us and we're trying to figure out how to mitigate their risk. And the other important thing is the time course of risk. So this little graph over here on the right shows that people with mental illness, they do, in the blue, kind of shows that just their chronic risk, they're always going to be at higher risk of suicide than just people in the general population who don't have a mental illness. But that risk changes over time. And when someone is in a suicidal crisis, their risk is going to shoot up. And that is a time when they're extraordinarily at high risk. And that's when we try to mobilize and intervene, where we try to act on these different risk factors to prevent their suicide risk. And when you're talking about guns and suicide, the question really isn't why are there, or is the suicide occurring, but it's how, it's what's the method. And this shows that suicidal crisis, the decision to attempt suicide, is a very fleeting and quick thing. This was a study that was done where they asked people, how long did you, these were survivors, obviously, of suicide, but they asked people, how long did you think about it before you decided to do it? And most of this was within an hour. The vast, like 75%, was within an hour, less than 5 minutes, 20 minutes. And then a lot of people, or survivors anyway, report that they immediately regretted it. And there was a really great, years ago, New Yorker article where they interviewed all of the people who have attempted suicide by jumping off the Golden Gate Bridge. And they all said that they regretted their decision immediately after jumping. And, when you've got a suicide method that almost all the time works, that's why you see such high rates of death with firearms. And that's one of the reasons too, while we looked at those stats in the very beginning, that was showing that suicide deaths are much higher in men. And that's because men tend to use firearms and hanging as their methods. So even though women attempt a whole lot more than men do, women tend to use cutting and overdoses, and so one of the most take home message of this is one of the most effective interventions we can do to prevent suicide deaths is to remove means. And it's not an all or none thing. We can't do those in Arizona, but there's ways, around making sure that clinicians know how to talk about firearms and counsel people around firearms, safer gun or firearm storage, and making sure that people know how to counsel people on that. interventions where, family members or someone else holds on to a gun during those high risk times. So there's all kinds of interventions that could be done when we're looking at the projects when they start to come through, that can be done to reduce this risk. So moving on to violence. Violence is a lot more complicated. So people with serious mental illness do have an elevated risk of violence. This is a large study that was done where they looked at the prevalence of violence within a year of people who had SMI, and it was 12% versus the general population was 2%. People with SMI who did not have a substance use disorder was somewhere in the middle. But when you do the math, because people with SMI is about 6% of the population, the vast majority of them are not committing any violent acts. So when you look at all of the violence, if you were to somehow wave a magic wand and just eliminate mental illness, you would still have 96% of the violence. So simply targeting mental illness is not the way to reduce all of all the violence. But there are subgroups who have increased risk. So when you look at the prevalence of violence, the number you're going to get when you do a study is going to depend on where those patients came from. So the study I was just talking about before was out in the general population. But when you look at people being discharged from psych units or people in emergency rooms, people who've been involuntary, who are in the hospital because they're being involuntary committed, you see much higher rates. And one of the highest risk groups is first episode psychosis. And this is a, potentially a pretty risky group because it tends to be young adults or teens, and the symptoms may go untreated for, a couple of years before that person has contact with the mental health system. And so since they're not having any contact with the mental health system, they're not going to have been, in the Title 36 system. They're not going to, these systems that, make them prohibited possessors, aren't going to find them. But luckily, in the last decade or so, there's been this big push to have specialty mental health services for people with first episode psychosis. And there's multiple clinics here in Arizona that specialize in that. There are, when you look at these subgroups with increased violence, there's diagnoses that increase your risk. So the psychotic disorders, personality disorders, which a lot of that's driven by antisocial personality disorder, and substance use is a big driver. And illicit substance use in particular. So, substance where people have to be engaged in some kind of criminal activity, to obtain it, in particular is associated with firearm violence. Alcohol intoxication is associated with being shot, with
Dr. Balfour,
yes.
it appears as if we lost you.
Oh,
I think when you were talking about alcohol intoxication associated with being shot, firearm suicide, I think that's when you cut out.
Oh, okay. I'll move to another part of the house. Maybe that'll help. But yeah, so, being intoxicated is associated with, being shot, with dying by suicide, and also accidental injuries. And when you look at when people are in crisis and the symptoms that they have can put you at be indicators of risk as well. So, for example, being paranoid or suspicious, especially when it's combined with being angry, that combination tends to lead to violence. Being intoxicated, just being intoxicated puts you at risk for all kinds of things. And those are some of the strongest predictors. There's really strong predictors between violence and poverty, being victims of crime, especially domestic violence, being involved with illegal drugs, like we heard with some of the earlier stats, having exposure to trauma, and then the crime in your neighborhood where you live. And these are factors that increase the risk of violence for everyone, not just people with mental illness, but people with mental illness tend to have a lot of these factors too. So it may be that's driving the violence more than the mental illness alone. And when they've done some studies where they actually are able to ferret out and look at people separately who have SMI who do not have these factors, their risk of violence is about the same as the general population. And then most crimes, violent crimes that do involve people with serious mental illness, they're and it's supposed to say are not, are actually not preceded by this exacerbation in symptoms. So it's kind of complicated. So, mental illness, this is a quote from a really good article that's linked below that reviews a lot of this data, where mental illness is one factor in someone's life that's can be relevant to violence, but it's not the only factor, and it may not even be the causal factor. So it's, it's complex. And so I'm going to switch gears and talk about our crisis system and how to access that, because when people are in crisis, you need to get them connected to care. And in most communities, Arizona is actually ahead of most communities. Most places, your only option for when someone's in crisis is to call the police. The police are the default first responders in most places. SAMHSA, the federal agency that funds mental health, nationally, they've got a vision for crisis services. It's really heavily based on the Arizona model, where everyone has someone to call, and there's a new 988 number, which I'll talk about in a minute, and then someone to respond, which is our mobile crisis teams, and then facilities for help. And a lot of that really was, based off our model. And in Arizona, everyone is entitled to crisis services. So the crisis system is run through our Medicaid, which is access, but everyone is entitled to crisis services, regardless of whether they have insurance or not. And for people who are not in the Medicaid system, it can also include some kind of time limited, for a few days, getting people connected, case management for certain populations. It's coordinated by the Regional Behavioral Health Authority. So that map to the right shows the states divided into the north, the central, and the south. And there's a Regional Behavioral Health Authority that contracts with all of us crisis providers. So in the central, it's Mercy Care. In the south, it's Arizona Complete Health. In the north, it's Care First. And you can see many, hundreds of thousands of people are served by our crisis system. So last July, a new 988 number went live. So now anywhere in the country, instead of calling 911, you can call 988. And what that did was it made an easy 3-digit number to connect you to the National Suicide Prevention Lifeline, which is really a network of call centers all around the country. In Arizona, 988 goes to Solari, that is the crisis line that is for the whole state. And Arizona's in a different position as most states. Most states didn't really have a really well-organized crisis line and crisis system. Arizona, we already had our crisis lines. And so most states, if you call 988, they're not going to be able to connect you to mobile crisis and all the other stuff that we have. So it's actually better for Arizonans to not call 988 and to call the state line, even though it all goes to the same place. And the reason why is because right now, the way 988 routes your call is by the area code of the phone you're calling from. So like if you're like me, where I lived in Texas before I moved here, so I've got a 972 number. If I were to call 988, I would get a call center in Texas that I'm sure are very nice people, but they can't give me a mobile crisis team here in Tucson. So they're supposed to fix it, hopefully, this year or next year. But until then, the recommendation, if you want to get the local crisis, even though it all goes to the same place, is to call that 844-534-HOPE number, or you can text it. A lot of people would prefer to text now, and that now we have that capability. And all numbers that you may know of, like if you're down here in Tucson, everyone's got 622, 6000 like burned into their brain. All those numbers still work. And there's a link here to the access page that's about the crisis line. Some of the tribal communities actually run their own crisis line. So people may prefer to call those. And there's also warm lines that are not for emergencies, for people who just need some peer support. As far as what the services, you can get after you call are, well, we got our crisis line, and they're able to resolve most of their calls on the phone. If not, then they can dispatch mobile crisis. They're, all over the state. And these are usually 2-person teams of clinicians, so not law enforcement. And they can go and do face-to-face assessments out in the field, do interventions. They resolve most of those out in the field if they're doing an intervention. And then we have our crisis facilities that either mobile teams can bring people to, people can walk in, emergency rooms can transfer to, and of course, law enforcement can drop people off at. And most of those folks can be connected to care, and then if they need to, they can go to like a step down or residential unit, like a group home. There's post-crisis wraparound that some of our peer-run agencies do. And then at every point along here, there's interfacing with law enforcement. And that's something that's like, especially the 911 collaborations is really growing over the last few years. So like in Tucson, there's crisis line staff, Solaris staff that are in 911, co-located. They're like that in a lot of, I think, comm centers up in Maricopa as well. And then mobile crisis teams, they collaborate, different in the different REBAs, how they do it, but a lot of collaboration with law enforcement. And then our crisis centers are really meant to be, that Arizona model is that it should be easier to drop somebody off for care than it is to book someone into jail. And so, I know our center, the UPC in Phoenix and the CRC down here in Tucson, we try to get those officers out in like 5 or 10 minutes. If you're interested in this kind of stuff, like the call center has live data that you could they have a whole dashboard you can go look at. And you can see how many people they're dispatching, how quickly they're answering the phone, how many calls that are getting diverted to them from law enforcement. There are about 20 or so stabilization units all over the state. That again, they're 24/7. Law enforcement can drop off there. Most of them offer like a 23-hour observation and then getting them connected to the mental health system. And then some of them can take involuntary. It depends, on how that REBA has things working. And some of them can take youth. And I just kind of wanted to end with, the Title 36 process, which I'm sure many of you are familiar with, and because this is the way that you get on, as a prohibited possessor. And it is, I'm not, because you're on the front end of it, a lot of, especially law enforcement here, and the whole process of what happens after you drop someone off, it is quite a process, and involves various assessments being done, 2 psychiatrists going to the hearing, and most of these, I don't know the Maricopa numbers off the top of my head, but in Pima County, only about 18% all the way make it all the way to the hearing. So, because there's a lot of incentive to try to engage people and have them be in voluntary care, voluntary care. And so, that's why just doing an emergency application may not result in them ending up as a prohibited possessor. And I know, we work really closely down with Tucson Police, where they have a team that focuses on these high-risk people and, making sure that we know all of the background so that they do make it all to that process. So I think those are the sorts of things too that might be helpful kind of programs as we look at the grants that we get. It's also important to know, I mentioned all throughout this when I'm talking about the risk, how substance use is such a high risk, but our Title 36 clearly states that, to go through this process, it has to be as a result of a mental disorder, and that not substance use or antisocial, which are, a couple of the violence risk factors. So that's a challenge as well. There's a link to some resources since you're going to get these PowerPoints. Also put the contacts for the different REBAs, because the details of a lot of how these things work and, what facilities do what, and depends on the REBA. And so the folks that run this, so it's Tanisha Hildebrand for Mercy Care in the central region, and then the southern and the north, it's both Johnny Gasper. And they're both great and super collaborative. And, if you have any questions or want to work with them, I'm sure they'll be great partners. So with that, I'm happy to answer any questions.
Thank you, Dr. Belfour. I guess, we're still seeing a lot of deaths by fentanyl overdose. And I guess there's an assumption there that that's unintentional rather than suicidal. Would that be accurate?
Yeah, I mean, it gets kind of gray too, because you have people who are like, well, I don't care if I live or die. So, if I overdose, then I overdose, so, so it's, I think there's a misery that goes with, especially being in the throes of opiate addiction, that it's not as clear cut, but that population is certainly at risk for death. And we're seeing a lot of more combinations as well. A lot of most of the overdoses actually have some other drug on board, and you're seeing a lot of benzos and meth as well.
Mm-hmm. Thank you. Questions or comments from committee members? Thank you again for that presentation. We appreciate it.
Mr. Chairman, that concludes our presenters. Just wanted to make a comment to you before we get to call to the public. Certainly, we will post all these presentations on our website, so you'll have access to the presentations. We also want to do more of these for you. Again, we're going to be around here with this grant for a long time. Appreciate Ms. Breed's request that we drill down a little bit more into some of this data and present that to you. And I would say to other members, if you have some thoughts on data that you would like for us to explore, please reach out to me or Sienni, and let us work on that. We're here to serve you. So there is no ask that is inappropriate. We will do what we can to find the data that you need. And I also wanted to mention too, we have not forgotten our rural friends or our tribal friends. And so we want to find some good data and a presenter that can talk about our rural communities or our tribal communities involving a firearm crime, injury, and death as well. So be looking for those presentations in the future. And Mr.
Thank
Chairman,
you, Tony. Thank you, Tony.
Call the public.
Okay, let me say first of all that was a lot of great information presented in less than an hour and a half, so I appreciate that. At this time, I'll make a call to the public. Is there anybody from the public who would like to make a presentation? Hearing none, are we ready to adjourn, Tony?
Mr. Chairman, yes.
Okay, then let me thank everybody for participating. And on my own motion, we'll adjourn at 2:48 p.m. Have a good afternoon. Thank you.
Thank you, member, Mr. Chairman. Appreciate it.